Namaste, and welcome, friends, to the Ultimate Makeover Salon. I can't tell you how glad I am that you've decided to join me here today. I'd heard you might be coming, and I prepared something extra special for you. I think you're gonna love it. I'm sure if you're here, you've been to other ASMR makeover videos in the past, but I can guarantee this one's special. It's really special. I've been preparing for it for a while, and it's calming and it's soothing, and most of all, it's gonna bring out your inner and outer beauty. It's gonna do both. It's gonna do both those things. It's not easy to do. It takes a lot of prep work, you know. So, I mean, I say we just jump right in. You know, why waste time? You know, a new, a more relaxed, a better you awaits. So let's just get started. Let's just jump right in. And to do that, first I'd like to introduce you to some of my little friends. There's a bunch. They're like the dwarves from Snow White, but instead of 7 of them, there's only 6 because that's all I have is 6. So, but here, let me show you these little friends. These are our little buddies. You see that? Aren't those beautiful? Look at those brushes, the different sizes, the different colors. Look at that pink one. And that huge one on the end there. It's beautiful. They're all beautiful. Every one of them. Sometimes I just stare at them for hours. It's amazing. Yeah, I can get lost doing that. Okay, so we have our 6 little buddies, and I say we jump right in. You know, what I'm gonna do is I'm gonna start brushing the sides of your face with our 6 little buddies. Gently, so gently, but it's gonna relax you, but it's also gonna sculpt your face into the most beautiful visage you can imagine. It's something else, I'm telling you. So let's get started here. Let's start with this little guy here. Look how little he is. He's tiny. He's itty bitty. Looks like a caterpillar's tongue. So I'm gonna take this little guy and I'm gonna just start gently brushing the sides of your face. How's that feel? It's amazing. Let's try the other side here. Does it feel good? That's important. It's very important that it feels good. It's not quite getting the effect I was hoping for. And maybe it's just because it's so small, you know. Maybe we need to just try a different one. Okay. I'll tell you what, I'm gonna skip the next one up now. I'm just gonna go straight to this pink beauty right here. Look at that. Look at that. That is amazing. Just imagine how this is gonna feel. It's gonna be incredible. You ready? You ready? You ready? Okay. Wow. Wowzers. That is unbelievable. I can tell. I can tell just by the expression on your face that this this is one of the greatest things you've ever experienced. If not the greatest thing, maybe it's the greatest thing. You know, I'm not going to judge the quality of your life if this is the greatest thing you've ever experienced. Maybe you're only 6 months old. You know, I don't know. But I have to say I can't help being a little bit disappointed in the visual effect. It's not really cutting it so far, so I'll tell you what, normally I would go to this one right here, but you know what, I'm just gonna bring out the big guns, this guy right here. And I think once we get this guy going, your face is it's gonna shape your face. It's gonna be I don't even know how to describe it. It's gonna be magical. Like, you ever see that movie Legend? It's gonna be like that. Like the unicorns. It's gonna be like that, but your face. Okay, let's go. Let's bring on those unicorns. Come on, unicorns. No whammies, no whammies. Okay. Is this on? I don't. I'm a little disappointed. I mean, I'm sure you feel a lot better, but you don't look much better. Normally, these brushes, I mean, these are the ultimate makeover brushes. You know, I've never met a face that they haven't been able to successfully make over. But you know, no, you're special. You're special. We're all special, but you're even specialer than that. So, you know, some people, they just need a makeover, and that's like 2 brushes, right? Some people, they need the ultimate makeover, and that's 6 brushes, sometimes 7 or 8 brushes. But then some people need the ultimate makeover. And I think maybe that's what you need right now. So, yeah, that's where we go from here. What do you think? What do you say? Do you want to give it a go? Okay, well, I'll tell you what. First, I need you to sign these papers. You know, look them over. Look them over a little bit. You don't have to look too closely. Just sort of, you know, get a summary. We don't have all day, so there's a pen right there. Yeah, just sign your name. Right over there. Yeah. Okay. Here. Thank you. All right, these look in order. It's a formality, really. Expensive? No. It's not that much more expensive, really, in the grand scheme of things. I promise you, it's worth it. So the first step for the ultimate makeover is, you see this mask? I just need you to put this mask over your mouth like that and just take a few deep breaths, like 6 to 10 deep breaths. Okay? Yeah? What? No. Ooh. It's not that unusual. Have you ever been on an airplane? These drop out of the top whenever they... Well, no, it's not. It's not oxygen. It's better than oxygen. This is organic. You gotta trust me. You've come this far. You've signed the papers. You're good to go. What do you say? Yeah? All right. Okay. So I'm just gonna put this right over your mouth right there. And just take some deep breaths. Slow, deep breaths. very relaxed. Here, I'll take the breaths with you. Ready? How's that feel? Keep going, yeah. You feel it? Yeah, it's starting to work. Just keep breathing. Better work, supermodel. Do a twirl, do your thing on the rug. Oh dear. You're awake. Okay. You're awake, or at least you're partly conscious. You're not in tachycardia, which is good. You're in a normal sinus rhythm. And that means that I can say with reasonable certainty that you're not in any pain, which is what I would expect. Moments of lucidity during surgery, sort of in the twilight of anesthesia, they're not very uncommon. They're more common than I think most doctors would like to admit. They're generally swept under the rug for a multitude of reasons. One, because nobody likes the thought of waking up in the middle of surgery. And two, because it's sort of a self-correcting problem in that generally, even if a patient does have a moment of lucidity during a procedure, they usually forget. So when they wake up, they have little or no recollection of being awake during the procedure. They might have some, it might feel like little parts of a dream. And I'm no neurologist, but they also seem to evaporate similar to how dreams evaporate, and you're left with little more than these sort of abstract images after just a few hours. So I mean, from there you can sort of get into a whole philosophical discussion about, if you go through a traumatic experience and then you forget about it afterwards, did you really go through the experience? And would you willingly subject yourself to a traumatic experience if you knew that you'd forget it afterwards? For all intents and purposes, it would be as if it never happened. So that starts to get into areas about what is experience and what is memory. What are the distinctions that we mark as our lives, right? Because if most people, the immediate reaction to a question like that, the reaction would be, well, of course I'm not going to subject myself to that. I don't care if I forget it or not afterwards. I still had to go through it. But if you have absolutely no recollection of something, the experience of going through it doesn't really belong to you. And it really may as well have happened to somebody else. And then you start to get into these areas of, well, as you age, you forget large periods of your own life. So are those periods that you've forgotten, are those actually yours? Or in a philosophical way, do we actually live multiple lives within what we normally call a single lifetime? You're probably not very interested in hearing about this stuff right now. So let's get down to business. We are, for the procedure that I'm doing to you right now, which you did sign papers saying you wanted, we're sort of past the point of no return. It would be more work for me to undo what I've done than to finish, even though you're awake. I'm not an anesthesiologist, and I'm very nervous about administering too much general anesthetic for your safety. So I'd rather not do that. I'd rather continue with the procedure. By the way, generally in these cases, the patient loses the ability, loses voluntary muscle control, but sometimes they retain some. So I'm going to ask you if you can blink for me. That's good. But I'm guessing you can't move your hands. Yeah. Yeah, so you have some very limited motor muscle control. But blinking is good because we can communicate that way to a limited extent. And what I'd like to do is I'd like to finish the procedure. I'd like to give you an extra amount of local anesthetic to your chin, your jaw, and your cheeks, and your forehead, and right around your eyes, where we still have some work to do. And I'm going to give you a little bit more general anesthetic as well, but it's probably not going to be enough to knock you out, because like I said, I'm a little bit reluctant to go too far down that route without really being in a proper facility. There's the Joan Rivers incident, which you probably know about, which kind of highlights the dangers of general anesthetic, not to mention, Michael Jackson, countless celebrities. And the reason I guess I mentioned celebrities is because celebrities tend to go through procedures like the one I'm doing to you quite a bit. So if you're ever in any pain, it's important that you know, first of all, there are ways of telling if you're in pain. You know, your heart rate will increase, your blood pressure will increase. You'll perspire. There's physiological, definite signs of pain, especially the kind of pain that you might feel during a procedure like this. So I will know when you're in pain, or you could also blink. But I'm going to go overboard on the local anesthetic, which you don't need to worry. There's no possible complications of that, not even like nerve damage or anything like that. And like I said, I'm going to give you a little more general anesthesia, so you'll kind of really be in the twilight, but you may still have some idea of what's going on. But if that's okay with you, well, I guess let me explain to you the alternative. The alternative would be for me to sew you back up as quickly as possible, which will leave you in a half-finished state, and we'll have to go back in and do this again. I don't advise it. I think you're going to be okay. You know, I'll talk to you through the entire procedure, the remaining half, a little less than half of the procedure. And like I said, if you are at any point in any pain, we'll be able to take care of that. So if you're okay with doing that, can you blink for me? That's awesome. Okay. I appreciate the vote of trust, and I'm not going to let you down. So let me turn on the general anesthetic again, and let's do that first. And then we'll do the local and get on with the procedure, okay? All right. Okay. All right, so I'm going to give you a little more general. Just breathe as normal. I was singing when you woke up, wasn't I? And I sing during procedures quite a bit. The line between the hard sciences and the arts is not as distinct as one might think. And music sort of engages the same part of the mind that is focused in things like this. And music can really kind of help, especially the right kind of music can really help. The right kind of music, right? I mean, that's subjective. But the right kind of music for you can really help focus your tasks, whether they're, fine motor work like I'm doing here, the kind of snap decisions that I have to make. It's really useful. All right, can you count backwards from? I guess you can't count backwards from 10. Why don't I count backwards from 10 for you? Okay, 10, 9. 8, 7, 6, 5, 4, 3, 2, 1, 0. Every woman, everything will be just fine. Everything will be alright. Hey, you were out for a few minutes there, so it did manage to put you out some. Things are going well. Let's take this out of here. be a little bit more local. Okay. So you've been doing really well. There haven't been any complications. Things are actually going pretty good, except for the fact that you're waking up. You know, I don't know what to tell you. You're not going to feel this at all. And I'm giving you quite a bit. Just in case we need to give you a little bit more later. So we've done most of the jaw work. We sort of resculpted the bottom there. You had a little bit of excess bone that you want to get rid of. So it's, it's good that you slept through that because, like I said, you wouldn't have felt it, but just hearing that is not great. Although it's not that different from dental work, really. It's your jaw. But nobody wants to go to the dentist either, right? It's just a standard scalpel. I just had been using one, got a little bit dull. Generally, after just a few minutes of use, these disposable scalpels really lose their edge. So it's not uncommon to switch, a few times during a procedure. So I'm moving to your eye now. And what I'm doing is just kind of getting this layer of skin and the very small amount of subcutaneous fat. So we can lift it up and do the work under there we need to do the other side too. And yes, paper towels. Because whatever does the job is what we use. So I just need to sort of grab the flap of skin here, pull it up a bit. And then what we have here is just like it's almost like a little awl. And I'm just going to do a little bit of shaping. Side too. Got some. A little more difficult there, but we did it. How are you holding up? Hey. Hey. Are you back with me? Can you blink if you can hear me? Okay, good. You went out there a couple times. Eye work is, I guess, a little more traumatic than some of the other stuff. But we've gotten through that now. I just need to do a little bit of cleanup for the eye. I mean, what I did, I've done quite a bit before. In fact, quite recently, I can't divulge the complete names of any of my patients, but I did something very similar to what I did here for you. I'll just give you her last name. I'm not going to give you her first name, but last name is Zellweger. So if you can puzzle that one out, you can see. Well, you're gonna forget all this anyway. You're not gonna remember names. Certainly, you're not gonna remember most of what happened here. But so let me just kind of clean some of this stuff up. I may have to give you a little more general in a minute here. According to the clock, might be wearing off here. I'd rather err on the side of giving you too much. Well, I'm sorry. I'd rather err on the side of giving you too much local. Not quite as much general. Let's see if that was okay. I hope that was okay. There's the eyes are very vascular. So they're messy to work with because the areas around there bleed a lot. There's a lot of vessels concentrated in those areas because there's a lot of complicated stuff going on around the eye. So I'm going to go ahead and give you a little more local and a little more general. Just a little bit. I'm gonna give you some around the eyes too, even though we're pretty much done there. Because that stuff's, you're gonna need that after you wake up too. It's gonna be sore. It looks like I got a little actually on your eyeball. Let's get that. You just blink for me. Seems to be pretty good. mean, you're holding up fantastic. This is, I've had a few of these during my tenure, and I mean, they all go reasonably well, but some have more panic than others. And you've been a champ. In fact, we're getting through most of this pretty quick. Excuse me for a second. I don't know how this got in here. Generally, we customize our kits for every procedure. This piece does not belong. Just do a little check here. Yeah, you're doing great. Okay, now I'm going to give you a little more of the general that we talked about. Just breathe normally. So, while we're waiting for this, one of the other things that sometimes happens to patients who are undergoing lucid periods of lucidity during surgery is they can sometimes get hallucinations, sort of temporal hallucinations. I'm not talking about demons coming to drag you away or anything like that. I'm talking about just sort of weird perceptions of time and even of space sometimes. So don't be alarmed if any of that happens. I'm monitoring you very closely. There are some psychological effects that I don't see the ramifications of, except for, like I said before, if you're in pain or if you're in fear, your sympathetic nervous system responds and your heart rate goes up. But you just you may not be experiencing reality as you normally do, and given the situation, that's actually normal. So I don't want you to be too worried about anything that you notice like that. I think we're pretty good. I see you're kind of at half-mast here. So. Okay. So your jaw is done. Your eyes are done. We wanted to do a little more around the underside of your eyes, by your cheeks. And then once we're done with that, a little bit on the nose. I know, right? I could use some nose work myself, but and then once that's done, I'm just going to suture you back up, and that'll go quickly. I'm a really good suturer, so and then we'll be done with this. And if you remember any of this, you'll have a story to tell your grandkids. But either way, I think you're gonna, I don't know if that is that pitch man who says You're gonna like the way you look. I don't know what that's for, but you're gonna like the way you look. Okay, so let's move on. Okay, so what I'm going to be doing here is essentially removing a small section of skin between the eye and the cheekbone here, and then bringing the two pieces together, and then the same thing back here, and that's just going to give you a much sort of tighter look to the skin around here, and you're going to like it. You're going to like it. It's nothing too drastic. I need to mop that up. Do the same on the other side, okay. Pop that up too. So you probably noticed that I don't wear gloves. I make sure that I'm very sanitary when I'm working. Generally, gloves are in hospital settings when you can cross-contaminate, and a lot of other things that don't apply here in this setting. And I find that I get a much more tactile, sort of immediate and precise response, which is very important, and I think I do better work because of it. So yeah, if you were wondering about that, that's why that happened. Okay, so let me remove that bit of skin. Same over here. Okay, let me see. Pretty good. Yeah, I think that's going to suture up really nicely. Okay, now let's move on to the nose. Okay, so the nose is really the last bit that's kind of complicated, because we have to retract quite a bit. So like I said, you're not going to feel it, and there's no, it's it's not bone in your nose, it's cartilage, so it has a lot more give, and the sensation is not as unnerving as when we're dealing with bone. So I think you're going to be fine, but I'm going to give you a little more local right around the nose before we proceed with that, okay? In fact, we have quite a bit still here, so let's use this. I have to get my smaller retractor. Just a little guy. Come around like this. On both sides. Let's rinse that. Mop that up. Again, like the eyes, the nose is very vascular. Maybe not quite as much as the eye, but pretty close. You okay? You seem to be fading out a little bit. That's okay. Don't fight it. There you are. So like I said, the nose is pretty vascular. So things can get messy there. But the amount of blood that you're losing, it's very easy to sort of see some blood and think, oh my God, I'm losing a lot of blood. You're not losing a lot of blood. We have 8 pints. You've lost here maybe during this entire procedure 1/8 of a single pint. So it's not a lot. It's not nice to look at, and I'm going to clean up here in a second. I thought you might be out for a few more minutes, but there's nothing to worry about, okay? Look at that. Looks like I slipped my wrist. Promise I didn't. If you take me to malpractice court, then I might slip my wrist. Nobody said surgery wasn't messy. Okay, so I'm going to do something a little different here. Let's get rid of that. I want to, as I'm doing the suture work, which we're onto the suture work now, which is, the final stage, I want everything to sort of contract and be immobile. And fortunately, we have something very good for that sort of stuff. Which I don't know if you can read this in your state or not, but it's Botox. So what I'm going to do is give you a little bit of what is essentially a poison in these amounts and in these just kind of subdermal injections. It's not poisonous, it's not dangerous, it's addictive. Lots of people do it and do it too much, and it starts to look silly. This is just going to make the suturing process a lot easier. So before I start suturing, this is now we're to the part where it's just cutaneous work. So, there's no cartilage, no bone being manipulated. It's just, we're just sewing you up. So it's, this is the home stretch. So, I don't think you were very worried through most of this, but if you were, now you can relax even more. I'm sure the sedatives and the anesthetic helps you do that. But you've done really well. You've done really well. Very nice job. You look like you're going out again. That's fine. Don't worry about it. About to start suturing. Suture needle got away here. So you can see this I don't know if you can see this very fine string here attached to the suture needle, but it's out of the way. Get started. A lot of surgical implements. It's kind of like the disposable razors and the phenomenon behind that. What you have are razors that are really, really sharp for a really short period of time. They lose their edge really fast, whereas if you use a straight razor, it's going to keep that edge for a really long time. In many ways, we've gone backward in that regard. And it's the same thing with these needles sometimes. The other side. Now, if you can sew, you can suture. It's all in this sort of wrist movement. But I gotta say, I'm pretty happy with the way this is coming out. I know you came here you walked in the door expecting a more traditional makeover. You got more than you bargained for. But guess what? You don't have to worry about this smearing. to reapply it. It's certainly more expensive, but it's a one-time expense. Oops. Once we get you all cleaned up, your friends aren't going to recognize you. It's going to be great. Let's swap up a little bit more. I'm happy with this. I think you're going to be ecstatic. So I'm really sorry that you didn't stay under for the entire procedure. There's nothing I can say, it has happened before. It will happen again. It's an inexact science, anesthetic. You're always walking the line between. The ultimate anesthetic is death, right? We obviously don't ever want to go that far, but the more alive you are, pain is life. So the more alive you are, the more pain you feel, and the more we dull your pain, the more we kind of muddy that distinction and it's dangerous. There's a reason why anesthesiologists have the highest malpractice insurance premiums of any specialty. It's also why it's becoming increasingly hard to find good anesthesiologists. They're being driven from the field by the sort of barrier for entry that is their malpractice insurance. And, it's hard to be too tough a judge either way. I mean, people have a right to know the risks of what they're getting themselves into, and they have a right for those risks to be as low as we can possibly make them. But they also have a right to not wake up in the middle of a procedure like you have, and deal with any longer-term repercussions. I hope that I was able to mitigate some of the trauma, if you remember any of this, by, sort of taking you through everything step by step and keeping your pain level as close to zero as possible. I think I at least succeeded in that last part. Let me do one more quick vital check on you. Alright, I gotta get cleaned up. It's all good. Check your pupillary dilation. It's good. Okay, so I'm gonna tidy up, and you're pretty much good to go. You're gonna need to be on bed rest for at least a week, and then it's gonna be probably, we're gonna have to change your bandages, a few times a day. And that's going to continue for a couple of weeks, because you have gotten some very sensitive areas, and we've, especially in the jaw, we've cut fairly deeply. But your eyes will be lifted, and everything that you wanted. I myself have my own personal views on the morality of cosmetic surgery, and yet I'll perform the procedures, certainly, because it's a business, and it's certainly not my place to judge. And to be honest, I think you needed it. I think you're going to be, much more confident person now, and or maybe the traumatic memory of these events will make you a sociopath. I can never really tell, but I hope not. And I hope to see you back in my office in a few weeks, so we can do the after pictures, which I know are going to be great. So, are you fading out again on me? That's right. When you wake up, you'll be in recovery. Everything went fine. Everything went fine. You didn't wake up during the procedure at all. You slept through the entire thing. You won't remember any of this. You're back. Oh my gosh, you look amazing. What a great job. What a great job he did, huh? I don't know, I was thinking, these brushes, man, that's crazy. That's crazy. I should just let the doctor take care of everything, right? So are you happy? Are you happy with the way you look? You haven't seen the way you look? Oh man, you gotta see it. Oh my God, you look incredible. Are you ready? You're gonna love it. I'm telling you, you're gonna love it. Ready?